Hello, everyone. We're just going to give a couple minutes for everyone to get settled in, and we'll get started right away. We don't have an open chat for this session, but we do have a Q&A. So if you do have any questions, please feel free to reach out in the Q&A. And if we have time, we'll get all of those questions. We'll also be sending a follow-up email for any questions that we don't get to that we really want to get to, and I'll be chatting with everybody after and make sure we get those questions answered and sent out by email. And then you can always reply to the email that was sent out. If you have additional questions, you can always reach out to me, and I'll make sure that those get through to the right people. Okay, well, we don't have a ton of time. Just a reminder that this webinar is being recorded. So everyone is aware of that. And I also wanted to take a moment to do a land acknowledgement. Vets Without Borders, we'll have guests from all over the world today, but Vets Without Borders, our office is located on the traditional and unceded, unsurrendered territory of the Anishinaabe Algonquin Nation. Our staff at Vets Without Borders works on the traditional territory of First Nation, Inuit, and Métis people from coast to coast. And we're extremely grateful to be guests on these lands. All right. I want to introduce our Executive Director, Charmaine from Vets Without Borders, to talk a little bit about what we do, so we have a little bit of context. And then she can introduce our fellow panelists, and we'll get going with questions. Take it away, Charmaine.
Good morning and good afternoon, everyone. It's such a pleasure to see this amazing turnout for our event today. Before we have our expert panel introduce themselves, as Charlie mentioned, I wanted to give you a quick bit of information and background about our organization. Veterinarians Without Borders was founded back in 2005 when a small group of passionate advocates of animal, human, and environmental health decided to change the world. Our organization now works in Canada's Northwest Territories, Sub-Saharan Africa, Southeast Asia, and today responding to the Ukraine crisis. Our organization has grown into a collective of passionate advocates, dedicated volunteers, and generous donors who work in collaboration with partners around the world to create healthy animals, healthy people, and a healthy planet. We believe in the One Health approach, which recognizes that humans and animals live in a shared environment, and there's added value to be gained by working together on health issues like that of rabies, with a wide variety of local and global partners. With work in over a dozen countries around the world, our projects are supported by individual donors, foundations, governments, and corporations across the globe. Our work is community-led, driven local, sustainable solutions, and spanning the international development and humanitarian sector. I am so honored to be here today at this roundtable discussion with our expert panel to hear more about their life-saving work and how they are working and advocating towards the eradication of dog-mediated human rabies. To start off, I'd like to have our panel introduce themselves, and I'm going to ask Kathy Duncan, the Director of Programs at Humane Canada, to share a bit of background.
Thanks very much, Charmaine, and welcome everybody. It's exciting to be here for sure. So Humane Canada is the national voice for animal welfare in Canada. We actually are a member-based organization that has been in existence since 1957. We're the Federation of SPCAs and Humane Societies across Canada, and we work to advance the welfare of animals with a strong national voice, promoting the interests and concerns of animals in animal welfare to government, policymakers, industry, and the public. We have a number of areas of focus. We look at policy and research. We work with animals in the law. We deal with farm animals and advocating on behalf of farm animals and their welfare. And we work with companion animals also, which is what brings us here today in the capacity of the panel related to the CFIA's ban on dog importation from certain countries. So thank you very much. And I'll put it over to Nina.
Thank you so much. Hi, everyone. Thank you so much for the opportunity to speak to you today again. It's a pleasure for me. My name is Nina. I'm a fundraiser with Happy Paw charity organization. Our foundation has been feeding, treating, and improving the life of homeless animals in Ukraine for more than 10 years now. At the moment, we cooperate with 120 shelters in which more than 35,000 animals live. And our main goal for now is to give every animal a home and make sure they will have a responsible owners. So we constantly promote adoption of animals from Ukrainian shelters. And today I will be speaking about the whole situation with Ukrainian shelters, with vaccination, sterilization, and other important topics. Thank you so much.
Thank
Greg?
you, Nina. Oh, sorry,
Oh,
Charlie.
sorry. Okay, go ahead, Greg.
Hi, everybody. I'm Greg Tully. I'm the country director of Save the Dogs and Other Animals. So the organization has been working for 20 years in Romania to protect animals and address animal cruelty. The programs include rescuing horses, donkeys, cats, and dogs from cruelty, abuse, neglect. We run a large shelter. We adopt the dogs and cats out to adopters in other countries. What else? I mean, education, community collaboration, those are all key parts of what we do. And since the crisis in Ukraine came to the forefront, we've been very active there too. It's been a big part of my role is helping people stay with their animals, providing food aid, and we're just right now just keeping animals alive until infrastructure rebuilds there.
Thanks, Greg. Michelle, do you want to introduce yourself and what you do with vets?
Hi, everyone. I'm Michelle, and I am the Northern Canada liaison for Vets Without Borders Canada. I'm also a veterinarian, and I'm located in Yellowknife, Northwest Territories. And Charmaine already gave a great introduction on Vets Without Borders work, so I think that is good for me.
Okay, great. Thanks so much, everyone. So I do want to prompt right away to get your comments on rabies as a deadly disease and how you see it affect your community. Is it an issue in your community? What's going on? And I think maybe we'll start right with you, Michelle, because it's an issue in Northern Canada. So I'd love to get your comments first.
Yeah, for sure. So yeah, I'm located in Canada's north, and with Vets Without Borders, I travel across the Northern Territories for temporary vet clinics. And rabies has always been something that has been a disease that has been present in the north. So rabies is endemic in the Arctic and red fox populations in the north. So that is our main reservoir of rabies. And as things have been changing in terms of climate variations, community buildings, things like that, fox populations have actually been finding themselves within the communities, and they have been starting to bring rabies into the communities. So it definitely affects, obviously, the health of the foxes, of the dogs, who are generally kind of, a guard dog or protecting dog at camps and at homes in the communities. And then obviously also affecting human health too, because if foxes are fighting with the dogs, then the dogs can also act as a vector to get rabies to humans.
And there's been a couple scares recently in northern communities.
Yes, so in 2021, there was actually a rabies outbreak declared in the Delta region of the Northwest Territories. And then this year, so far in 2022, there have been multiple confirmed and suspected cases of rabies, specifically in Nunavut, in some of the remote communities in the territory.
Great, thanks. Greg, Romania is actually where your main shelter is located is actually not on the banned list, but we know that you have to deal a lot with rabies because you generally adopt outside of the country. I'd love to learn more about that.
Yeah, Romania, fortunately, it's had very few recent reported cases of rabies in dogs. I mean, there is rabies in bats, foxes, boars, and other wildlife. It's still, according to the research, it's still among the highest rates of human and animal rabies in the EU, but that's in the EU. So compared to a lot of other countries, it's has very low rabies rates. But it's still, it's still a concern. There's a huge number of stray dogs in Romania. There are a lot of dog bites, and so there's a lot of potential for outbreaks that would be difficult to contain with the sort of these especially in the roaming packs of dogs. And and because we do work internationally, so it's a constant concern, especially we've taken in dogs from a shelter in Odessa in Ukraine that was damaged by a Russian military strike. And so we had to be, extremely careful taking in dogs that had no known medical history and, starting from scratch, all the vaccinations and quarantine. And with our international adoptions as well, that rabies brings a lot of complications. I can say the dogs does, even though rabies is low among dogs in Romania, we really focus on widespread vaccination and spay-neuter in our working area to to reduce the risk of rabies outbreaks and keep the dog and cat populations manageable. And there are other organizations in Romania that are doing the same, but by far most of the country is not covered by charity organizations. So there are just huge areas where basically nothing is being done to address rabies. Just outdoor dogs, guard dogs, community dogs that aren't being vaccinated, and surveillance also is really lacking. It's the data available is sort of a group of researchers did a research project 10 years ago and it was published, things like that. There's really not comprehensive data available.
Great, thank you. Nina, tell us about the state of rabies in Ukraine.
Hard. Unfortunately, Ukraine remains the one country in Europe where rabies is spread among animals, sadly but true. So, of course, we can see the justification of this ban. We understand it. We know why everything is going in this way. But still, we have a great impact of this ban on our work and on the work of our shelters because of the full-scale war. All our achievements during the past 10 years are wasted, sadly. So the war pushed us back 10 years, and the situation is getting worse every day. Every day we receive dozens of requests from shelters, from volunteers, from refugees who want us to take care of their animals. Also, we get a lot of requests from other organizations just to evacuate animals from the combat zones. So, to be honest, rabies now is not our biggest problem in Ukraine because of the war. But still, we of course understand that the vaccination is the only way actually to stop rabies in our country, and we're still trying to vaccinate animals even in shelters near combat zones because we understand that we need to do this. But situation is really hard. I won't lie about this. Yeah.
Thanks, Nina. Kathy, can you kind of give a snapshot of what's going on in Canada-wide?
Yeah, I think Michelle covered some of it.
Can't hear you.
Can you hear me?
There we go. We got you.
Okay. Michelle covered some of it, given that she's from the north. I'm based in Ontario, where rabies is still an endemic disease. We're still seeing it. The province of Ontario does a significant amount of rabies surveillance and bait dropping. There are concerns about rabies coming across the Canada-US border with animals. There's a significant challenge with rabies as well in some of the eastern US states. And according to the Global Alliance for Rabies Control, or GARC, across the world, 99% of all human rabies cases are the result of an exposure to a dog with rabies. So while we're seeing it in wildlife in Ontario, you know, dogs often are that conduit between wildlife and people. So if a dog has an interaction with a rabies positive animal, and then they have contact with people, because dogs are man's best friend, that's where we see that cross happen. And, you know, according again to GARC, rabies is responsible for the deaths of about 59,000 people a year across the globe, and 40% of those are children. So it continues to be a concern. It is endemic in Ontario. It is, as Michelle noted, you know, found in other places in Canada. And there certainly is a recognized pattern with respect to the Arctic fox strain of it coming from, you know, Labrador, northern Quebec, and northern Ontario, and coming down into the southern parts, more populated areas of Ontario. My background is working in animal shelters in Ontario, and we're considered high risk for exposure to rabies. So we're always vaccinated for rabies, all shelter staff. We handle wildlife, but we also handle, you know, animals that are strays and cats and dogs that come from the communities and can have had access to or connection with rabid animals. And so there is an ongoing concern because, of course, rabies is fatal for people. So.
Absolutely. Thank you. So I mean, this being about the export of animals, I'd love to learn more from Nina and Greg about what are the challenges you have exporting to Canada or wherever you're seeing your dogs exported to. Love to know a little bit more about that because people are really curious about the logistics about that. Nina, do you want to go first?
Yes, of course. I will also tell a little more about the adoption situation in Ukraine for you to understand why for us this ban is so bad decision actually, because now the adoption level in Ukrainian shelters is extremely low, around 2-3 animals per month. Just to compare that, before war, it was around 100 animals per month. So it's awful. Ukrainians doesn't want to adopt animals because they don't want to take this additional responsibility for someone's life, because they cannot even take responsibility for their lives right now, because there is no safe place in Ukraine at all. So Ukrainians don't want to take this responsibility. So 0 adoptions from Ukrainians. And then in March and April, we got a lot of messages from people from abroad that they want to help us. They want to take our animals. There was people from Europe, from Canada, from America, from all world actually. It was really touching for us, but with each passing month, of course, we received fewer and fewer such messages. We understand why. And of course, we also understand that transporting an animal means very dangerous and expensive logistic for now, because we don't have air transportation at all due to war situation. So it's expensive, it's dangerous, and we also need to choose very carefully company for this transportation. So a lot of problems, causes a lot of problems. Willingness of the adoption of our animals was a signal from the world that our animals are wanted and interesting. But then we got another signal, sadly, that our animals are dangerous. And of course, we understand why. So the opportunities for adoption from other countries are actually closed for now, for us, for our organizations, for shelters, for everyone. Of course, this made us really sad, to be honest. But then we understand that we can take this as an opportunity to try to solve the problem of homeless animals in our country from the inside. And the best way to solve this problem, and the best and the most humane way, is sterilization. So we was trying to make more sterilization because of the ban, because of the problems with transportation of our animals. So, like that. Thank you.
Yeah, and logistics are quite difficult at this time, even if countries were open. I know some countries were willing, but we couldn't get those logistics going just because.
Just logistic is awful
Yeah.
right now.
Yeah.
We cannot do
Yeah.
anything. So sadly, but true.
Yes. Greg, I'd love to know a bit more about when you export. I know that there's like a very intensive, within the European Union, a very intensive process about, especially concerning rabies.
Yeah, I guess first I'll say for Save the Dogs work, international adoptions are essential. Our shelter's always near or at capacity, and we're in a rural area of Romania where there are very few adoptions. We're working hard to increase adoptions, but there's just really not a culture of, the thinking is sort of, why would I drive to a different town and go to a shelter and fill out a form when my neighbor has puppies every year and I can just get a dog from them? So for our shelter to function, to be able to continue to rescue animals and provide long-term care, we depend on international adoptions. But yeah, there are a lot of challenges with doing it. I mean, definitely not as many challenges as from Ukraine, but still, the costs are one. Air cargo is expensive. If you're sending animals as cargo, you pay based on the size of the carrier that they're in and the distance they travel. If a passenger will fly with a dog or a cat as their extra baggage, it can be a lot cheaper. It depends on the airline. It might be just, say, a couple $100, but you need a passenger who's willing to travel from where the animal is to where the adopter is, and that matchmaking sometimes it just doesn't work out, or it ends up being even more expensive if you're paying for a passenger to come as well. I mean, of course, there's the stress on the animals of long distance travel. It seems like some do pretty well. It seems like they settle down in their crates and they're in a dark space with a blanket or with something comfortable. Others are clearly stressed by it. So that's something we always worry about. Another complication is that, if you're adopting out thousands of animals, some percentage of these adoptions aren't going to work out well. It's just unavoidable. And so the animal can't stay in their home. And so we, as Save the Dogs, we generally work with partner organizations in the countries that we send dogs to, so that they can provide this local support. If a family is having trouble with their new dog or cat, they can, maybe do a site visit, provide advice. And if it's clearly not working, they have networks of foster homes, and then they can rehome the animal locally without needing to send it all the way back to Romania again, which is more stress, more cost, etc. And so yeah, it's not easy. And as you mentioned, in the EU, there's a database that people need training to access, and a lot of extra steps, and if you make mistakes in any of those, the animal might be turned away at a border. And so it's the sort of the documentation as well is really onerous. And so yeah, we almost always do adoptions within the EU, because it's, even with those complications, it's still easier than sending animals to another continent. But we also still do I mean, if someone wants to adopt a dog to Canada, to the US, to wherever they are, we'll try to make that happen. But yeah, sadly, it would be great if it was adoptions were the solution to the huge number of animals in our shelter, but the way it is now, it's just not enough. It's too difficult.
Absolutely. We know that EU is highly regulated, so there's like multiple rabies tests. You have to confirm that they have the vaccine. You have to do lots of blood tests, so the animals are in your shelter for quite a while as well. Is that right?
Yeah, that's right. Yeah, SNAP tests, PCR tests, variety, rabies vaccines, and then you have to wait 21 days before the animal can travel. It's we have a huge checklist for the veterinary department, for the adoption department, for the logistics manager. Everyone has their own checklist every time we're sending animals out, and it's a lot to do.
It's an undertaking. So hearing about the highly regulated situation in the EU, Kathy, I think maybe you'd be the best one to answer this. What would it take to regulate imports here in Canada? Is there any regulation before this ban? Because just kind of overall just kind of ban, and is there any kind of tracking of international imports for dogs?
What it would take to regulate it at this end would be a huge influx of resources. So manpower, boots on the ground, people that can go out and follow up when there are permits with respect to animals being imported. And so it's not just a case of the paperwork with respect to the animals coming in, which does have an administrative burden, but it would also be the follow-up once the animals arrive in Canada and are dispersed to the various places. They'd need to be followed up on to ensure that their health is appropriate, et cetera. And is there tracking? That's a good one. Yeah, no, there isn't. There may be some tracking of paper, but I think to Greg's point, I think a lot of the onus for ensuring that there is compliance currently falls to the organizations that are doing the work, and not, there just is not resources within the government. And so I think in a lot of cases, people are like, well, it's highly unlikely that anybody's going to follow up with me. So if I just sort of bend the rules a little bit, I don't know what the regulatory bodies are like in the EU and how much follow-up they actually do with respect to what's required of people like Greg and his team. But certainly in Canada, we have currently got challenges just in the transport of livestock across the country for slaughter and enforcement of the regulations related to those animals and keeping tabs on their welfare. So I can't see that the opportunity would really present itself for much in the way of regulatory follow-up at this end. We did have a dog in Ontario last year that had been imported, and it was actually diagnosed with rabies. And then there's the huge, essentially, contact tracing, right? That has to happen as a result. So definitely a fairly large requirement for follow-up, and it's unlikely that it would be possible.
Great. Oh, it sounds like it would take a major shift in government priorities and animal welfare across the board, but I know there's lots of other priorities that are always competing for government resources. So hopefully one day it feels like we're getting there in baby steps here in Canada. So it sounds like across the board, the real solution is those spay-neuter programs, investing in vaccinations, so we don't need bans like this. Now that's a really big effort in the north. Michelle, can you talk a bit about the northern model that Vets Without Borders has and how it could be rolled out internationally?
Yeah, so the Vets Without Borders Northern Animal Health Initiative was just operationalized this year. We were in pilot mode since 2019. And basically what we have been doing since 2019 is partnering with local communities who have reached out to try to establish long-term sustainable program for dog management or animal management in their community. So the Northern model is really focused on community-led partnerships. We have a One Health focus, so increasing the health of the residents, their animals, and their environment, and really providing community empowerment to be able to lead these programs and to create, like I said, a long-term sustainable model. So currently, as of this year, we have 10 partnered communities, and then also 3 partners that are kind of like local organizations to the north. So what we generally have been doing with this is that we travel to the communities as we are invited to them, and we provide a temporary vet clinic. So that includes vaccinations, of course, for rabies, as well as other diseases for cats and dogs. It includes spay and neuter surgeries, as well as any other kind of medical or health concern that we are able to properly handle given our remote locations. Sometimes we set up clinics in a fire hall or in a school gym, so it's obviously not the same types of environment as a regular clinic. In addition to doing the temporary vet clinics, as I had mentioned, we do provide a lot of resources to the communities in how they are able to establish a program themselves to create awareness, education, and hopefully, again, have everything that's more community led, that they're making the decisions on what is going to be happening in their communities regarding their dog populations. And I do want to say, like up north, it's generally dogs that we do see. There is like a handful of cats that we see when we go into the communities, but generally it's the dog populations that communities tend to have concerns with. And so, of course, that is a big thing too, because they can be the link between wildlife who potentially have rabies and humans. In terms of, there's a lot of logistics and funded needing, there's a lot of local partnerships. And so if this could be rolled out internationally, absolutely. And there's definitely some programs and models that are already in other countries that have a lot of similarities with the program that we do. And we do find some parallels between those as well. Oh. Did we lose Charlie?
Lose Charlie. I think I saw that Charmaine was now made the host.
Yeah, Charmaine is now made the host. Okay.
Yeah, I think we're having a little bit of connectivity issues. Sorry about that, everyone. Greg and Nina, I'd love to hear from you. What is the best way to help the animals in your communities right now?
Should I start, or Nina, do you want to go first?
No, please.
Okay. I'll say, Nina, this has been mentioned repeatedly, but spay neuter is really the best approach. Dog population, I mean, bigger than that, I would say dog population management and cat population management, combining widespread spay neuter, rabies vaccinations, working with communities, working with government officials. This has repeatedly been demonstrated around the world to sustainably reduce large populations of dogs and cats. I mean, rescue and medical treatment and adoption are all really important parts of our work. We wouldn't want to just ignore requests for help for an animal in need or just ignore the veterinary care. But, that work helps one animal at a time, and it tends to be a lot more expensive than doing more of a large scale methodical approach. However, I'll say, doing dog population management requires a lot of resources, and it's only really effective if it's done on a large scale, either for many years or with a lot of vets sterilizing every day. If it's just done on a small scale and then you stop, you're probably not going to sustainably reduce the population or sustainably reduce rabies. It's a huge effort. Conducting surgery on tens of thousands of animals is really expensive, and the logistics are, the logistics are huge. I've seen a lot of times in small and medium-sized nonprofits, they'll run a spay-neuter program for a while, but then maybe they have management problems for a couple of years and the program stumbles, or for a year or two, they can't hire enough vets, or most often they just don't have enough money to run it consistently. And so they'll do it for a few years, and then it stops for a couple of years, and then the dog and cat populations build back again. And it can really, it's essential, and it's been demonstrated to work, but I feel that it really needs a lot of resources and long-term planning to make the impact that we want it to make, to sustainably reduce the populations and stop rabies in the local areas. But Nina, what are your thoughts?
Of course, I totally agree, because in Ukraine, we now need to, prevent ecological catastrophe. And the only way to do this is sterilization of animals, because there are a lot of abandoned animals, a lot of lost animals, animals from combat zones. They are not sterilized at all. So it's a huge problem for Ukraine right now. And also we have a big problem because sterilization is in our country have serious public opposition due to a lot of stereotypes about that. Pet owners doesn't want to sterilize their animals because they treat their animals like human beings, and they don't want to make an operations for them. No, really. We also don't have any laws that requires pet owners to sterilize their animals, like zero laws. That's awful. So these abandoned, lost animals end up on the streets or in overcrowded shelters, and they're still unsterilized. Also, we as organization, of course, trying every year to make some projects about sterilization in our country, but even businesses doesn't want to take a part in it. They don't want to donate money for it because they are afraid. What will people think about this? What will people think about their the money that they are giving to our sterilization programs? We are fighting every day with this, and it's really hard sometimes. Also, we had some municipal programs, of course, for sterilization, for vaccination. But now, due to wartime, we don't have any because lack of funding provides that we don't have any municipal programs right now. It's all just done by volunteers and a charity organization like ours organization. And the best, the number of domestic animals on the streets is now the highest in the history of Ukraine. And we're just like, oh my goodness, what should we do? It's awful. So, we're really thankful for Veterinarians Without Borders, because thanks to you, we managed to sterilize in the past 6 months 2,800 animals in 16 shelters in Ukraine, sometimes under the shelling. And I'm not joking. So just for you to understand the situation. So, and we are ready to sterilize even more than 1,000 till the end of this year, because we know how to do this. We have contacts with clinics, with volunteers, with doctors, with everyone. So we are ready to do this. with your support, and thank you so much for it. And we are also even ready to sterilize animals in deoccupied territories, because we strongly believe that we will deoccupy all our territories, and we are also ready to sterilize all animals on these territories. So thank you so much for your support. It's priceless, really. Thank you.
I mean, made possible by all the generous donors that that we have. It's been really amazing to see communities come together behind Ukraine, and hopefully we can keep it going. Michelle, in the north, what is the best way to support northern communities right now?
So as Greg mentioned, like continuity of care is so important. And, you know, it's interesting how there are so many parallels in Ukraine and Romania and in the north. Of course, they're much larger scale than the north, with all the communities being so remote and much smaller. So, you know, there sometimes are stray dog packs that kind of form in some communities, and so like he said, going in there and, you know, going to a community, doing one spay and neuter campaign, vaccinating one time is not going to make a difference. So the continuity of care and returning to these communities, engaging the communities so that they want to have these established partnerships, and again, having community-led programming so they're in control of what they want to do with their population is super important. But going back year after year, that's what's going to make the difference. And there's a lot of organizations that do work in the north. Some of them do provide continuity of care. Our Vets Without Borders Northern program does provide continuity of care, and that's what we aspire to do, to be there every year for these communities if they are continue to be engaged and want us there. So continuing to provide education, awareness, and just being there for support is just the best way to help get the animals kind of what they need to be happy and healthy.
Thank you. So Kathy, I think this one's for you. Organizations that are tackling rabies are hoping, specifically dog rabies, are hoping to eradicate it by 2030. What would it take to make something like that happen so we don't need bans like this?
Well, I want to go back a bit to the question that was just asked previously, because I think it really ties in. You know, you hear Greg and Nina talking about, and Michelle as well, talking about the need for concentrated programs in the countries of origin with respect to spay neuter. But if you're going to do that, guess what? Rabies is 100% preventable disease. You can vaccinate at the same time. And, you know, I'm interested to hear what's happening specifically in Ukraine and in Romania. I have a colleague who was just in Bulgaria, where they have a nationwide population reduction program. So they turned away from the euthanasia or the culling of animals and are focusing on trap, neuter, return, essentially, what we would call trap, neuter, return for stray dog and stray cat populations countrywide. And, you know, in looking at some of the statistics that actually came out with respect to what happened in Bulgaria in 2021, they actually captured just over 23,000 stray dogs in 2021. 21% of those were adopted, but the rest are returned to their original location. And that's actually a 12.6% increase from 2021 to 2020. And when you look at the information from the Global Alliance for Rabies Control, what they're actually looking to eradicate is not specifically canine rabies, but it's human dog mediated rabies deaths. So it's the death of people in relation to canine rabies that they're trying to bring to zero by 2030. And again, you know, it's completely doable because of the fact that you can prevent rabies through vaccination. So when you combine the sterilization of the dog populations and you vaccinate as well, you get, two bangs for your buck sort of thing, from the standpoint that you're protecting people, because one of the leading reasons for dog culling in countries where rabies is endemic is the fear of what will happen if you get bitten by a rabid dog. So people don't want rabies. As I mentioned earlier, 99% of the human rabies cases around the world are a result of an exposure to dogs. And so, you can't adopt your way out of this. You've got to look at targeted sterilization and vaccination programs. And ideally, it would be great if it could be countrywide like it is in Bulgaria. Just last week, Humane Society International India released information about a program where they have achieved an 86% sterilization rate of street dogs in a particular area of India. And what they've now done, to Michelle's point about it being community-based, is they worked throughout that program, which was in effect from 2017, with the local community. And they've now turned the program over to the local community after recognizing this 86% sterilization rate. So yeah, it takes a lot of resources, but so does, as Greg pointed out, importing individual dogs to other countries and or continents. There's a lot of logistics and resources involved in that. So focusing in the communities, I think, is really the best way to get that eradication happening, and the best way to ensure that we're not dealing with these huge populations of unhomed dogs.
Thanks, Kathy. So, obviously there's a model for it. It's doable. We're seeing success in other countries. Romania is seeing very little rabies, but still having population issues. What would it take to make this happen in your location? Is it funding? Is it more vets? Is it education? Kind of dig into that. I would love to know. Nina, we'll start with you.
You mean what should we do?
What would it take internationally to support you to make sure that the eradication of rabies can happen?
We should definitely continue to extend our sterilization and vaccination programs, because we understand that this is the most important topic right now for international donors, for example. They need us to be seen as people who understand why it's so important to make this vaccination to prevent rabies and make sterilization to prevent the increase of animals in Ukraine who are homeless right now. So we need to work on it a lot. And we're trying to work on it for 10 years already. And we have a lot of, successes, but still a lot of problems. I was actually talking about this, about sterilization, that people have such fear and such a big number of stereotypes about, and vaccination also, of course. Nobody wants to vaccinate their animals. Nobody wants to sterilize their animals. It's just like animal. Why do you need to do this? It will grow. It will be okay without these stupid things. I'm sorry, but it's like that. So we will continue to do this, because we need to save not only our country, but we need to save our ecological situation, because homeless animals on the streets, on every country, is a huge problem for this country. So we will continue to do this. And again, thank you so much for your support. We completely understand the reason for this ban. It's sad, but we understand it, but we still feel your support, and it even grows. So we're really happy that we have you by our side, and we will be going strongly, and we'll be doing everything right. So thank you so much.
Thanks, Nina. Michelle, what do you think it'll take for the Northern program to get rid of rabies in the North?
Yeah, so I'm not sure like what the background and what the knowledge is of our viewers today. So I just kind of wanted to clarify too that this dog import ban is so that we can prevent the spread and establishment of dog rabies, of canine rabies. So canine rabies, we do not have it in Canada. We have other different strains and variants of rabies within wildlife, foxes, bats, raccoons, that can all be spread to other mammal species, but we do not have canine rabies, which means that we don't have dog rabies where dogs are the reservoir species and the rabies can just be spread amongst that species, the dog. So if we had dog rabies come into Canada, and especially come into Canada's north, where everything is already very remote, there's really limited access to vet care and vaccinations, there would be some big problems that would be established, because if it spread through the dog populations in the north and was able to remain established within the dog populations, that would have some very, very, very incredible public health implications on it. So I just kind of wanted to clarify that, because we have fox rabies up here, but we don't have dog rabies, which means fox rabies can hang out in the foxes and sometimes they'll come to town and then they can spread rabies to the other dogs and to humans, but it's not established and able to be, staying in one species of the dog. So one thing that it would be an amazing way to help eradicate and to prevent rabies spread in the north would, because there is such a limited access to vet care. So the communities are really relying on, the northern program to come in to provide vet care. But one thing that we also do too is we do provide some training to people in the community if they're, interested in it. And something that we want to work towards, which is also something that is kind of trying to be established across the country, is a standardized lay vaccinator program. So even though we provide continuity of care, but that usually means that we can only go to a community once a year. So what happens to the people who are out of town then, who couldn't bring their dog in to get vaccinated? What happens to somebody who does get a new dog, or a litter of puppies that's born who can't get vaccinated when we are there because they're too young? So having a standardized lay vaccinator program for the north would be an amazing program to help decrease the threat of rabies in the communities. Right now, the governments of NWT and Nunavut, they do provide rabies vaccinations to all communities, but that doesn't necessarily mean that there's somebody in the community who is properly trained to administer those vaccines. And if there is somebody who has been trained, by us when we're going through or whatnot, there's just not a standardized program yet that actually recognizes that if that dog is vaccinated for rabies by somebody who is not a veterinarian, it is not recognized as an actual vaccination in the eyes of public health. So it's a bit of a tricky gray area right now, because we want to get all these animals vaccinated as much as possible, but right now it needs to be done by a veterinarian. So if we had a standardized lay vaccinator program established in the north in these communities, that would really help to control the threat of rabies across the north.
Amazing. I know that that's going to be something that we're going to be working on. So I'm excited to talk more about that in the future. And I'm sure Humane Canada will be involved. Greg, one last comment from you.
Well, yeah, to really sort of solve the canine rabies problem, at least in Romania, it would be a huge coordinated effort. Yeah, it would require a lot of funding, vets, nurses, trained animal handlers. And I know in many countries around the world, there's a shortage of vets and nurses. And that's absolutely true in Romania. So yeah, that would be a challenge. I mentioned the surveillance before, just fundamental research needs to be done to figure out where are these rabies cases happening, where have dogs been vaccinated, where they've not been vaccinated. And we need a much better coordination among the nonprofits that are working in the area and also government agencies, and figuring out where are organizations like Save the Dogs vaccinating a lot of dogs, and where are the gaps that no one is addressing. I mean, that's, just getting everyone into the same room to talk about these things sounds easy, but it's not. And so, I do think it's possible, but it would take a huge effort and a lot of coordination and years. But it's absolutely a priority. I don't want to sound overly negative, because it's one of our major focuses. We're spaying and neutering and vaccinating dogs and cats every day, and I know other organizations are in Romania and obviously around the world as well. So I do think it's feasible, but I mean, funding and coordination I would say are the biggest challenges.
Absolutely. Great. Thank you, everyone. I want to just take our last couple minutes to address some questions that have popped up in the chat and that were submitted beforehand. Kathy, I think this would be best for you. Can I still import my personally owned dog to Canada from a high-risk country? And what are the quarantine rules around that?
Okay. Well, I don't know that there is provision for importing from a high-risk country at all. I did a little bit of research prior to today's chat, and the CFIA has a website that talks about bringing in personal animals, but the drop-down menus don't include the option to import from even a personally owned dog from a high-risk country. So best to check with the CFIA on that, but they do have some pretty specific information about bringing in your personal pet dog, and they define that as a dog that's intended to live with the owner who is bringing the animal into Canada, and the dog is not intended to be transferred or given to another person on its arrival, nor is it intended for commercial purposes such as reproduction, breeding, or sale of the offspring, among other things. It also speaks to the fact that the owner has to be the importer of the dog and be able to provide documentation that demonstrates that they own the dog and that they obtained ownership prior to it entering Canada. They should have a hard copy of all of that documentation because it might be requested on arrival. And what type of documentation might you need if you're coming from a country other than one of the identified high-risk countries? A European Union pet passport is an acceptable alternative for a rabies vaccination certificate, as long as you have all of the requirements that are outlined on the CFIA website, such as it has to be written in English or French, it has to be issued and signed by a veterinarian, etc. You might need to provide advance notice of your arrival to ensure that there could be a CFIA inspector present where you arrive, because sometimes that's a requirement. You'll need the valid rabies vaccination certificate and a veterinary certificate of health. So yes, you can still import your own personal dog. I can't speak to whether or not you can do that from one of the countries that's been identified in the proposed ban that's high risk.
Great. I know that we had some questions change around a bit here. What about responsible rescues that were already vaccinating and quarantining? Is a great question. So I want Kathy to answer this because I know that there just recently made amendments in the US who put this ban in a while ago. I'd love for you to talk about those amendments because those would apply to those rescues looking to get special permission eventually if those amendments ever came to Canada, and kind of talk about that.
Yeah, sure. So to your point, Charlie, the US did adopt similar regulations to what's coming here in Canada, and they did that 2 years ago. Then in June of this year, they actually made some amendments, and included within those amendments is the ability for foreign vaccinated dogs, which are coming from high-risk countries, to be imported in certain circumstances. So they have specific requirements for people bringing in 1 to 2 dogs or 3 or more dogs. 3 or more dogs, if they're coming from high-risk countries, would be required to arrive at specific ports of entry, and there are only 4 in the entire country in the US, in Atlanta, Los Angeles, New York, or Miami. They have to have a valid rabies vaccination certificate. They have to have adequate rabies titers done. They may have to complete a 28-day quarantine, depending on what they have as far as the titer testing, et cetera, goes. And that has to be done at specific facilities, as I said, through the ports of entry. So there have been some changes to the regulation that came into effect a couple of years ago in the US that now permit for a very specific and limited importation of dogs from high-risk rabies countries.
Amazing, thank you. Well, we've gone just over our time, so I want to be respectful of everyone's time. I know there was a really kind question from the audience about what's the best way to donate and support the spay-neuter programs and vaccinations in Romania and Ukraine and Northern Canada. Well, we support all of those through VETS, but we're also send out links from all of our partners here. So I'll send a follow-up email with all of the links, or you can check them out on our site of vetswithoutborders.ca. And I know we want to get some final comments from all of our participants here, but we'll put all those in an email because I want to respect everyone's time. And thank you so much for attending. We really appreciate everyone coming. And this is a really big change. There are a lot of international rescues in Canada. I think one of the surveys, amateur surveys done, well, a university survey done was that 1 in 10 dogs in Canada are from other countries. So it's important. Thank you so much for attending, everyone. And we will send out a link to the recording. Okay, thank you.
Thank you so much.
Thank you,
Thanks,
everybody.
everyone.
Thanks
Bye.
for having us. Thanks for coming, everybody.
Cheers.